Welcome back. Dr. Greg Brannon is back with us, and you have a lot of information, but I know it's a life-changing moment for the folks who are watching today. So I want to follow up, and I want to get into the supplements here in a minute, but we were talking about hormone replacement. Can you give us a personal story, maybe a patient that you've treated?
Yeah, I want to go over a couple of that thing, because I'm sure people wake up in the morning, they're moving a little slow, a little achy. That's not normal, okay? That's not optimal. But we think about people our age. Of course, right. Hormone levels decrease with age, therefore it's the fountain of youth. It's not the fountain of youth, but it definitely helps our body work better, okay? Now, we do sometimes don't think outside the box. I had this wonderful 20-year-old man. 20-year-old, has 2 kids. He literally said, Greg, I'm ready to end my life. If it wasn't for my wife and my children, I wouldn't exist anymore. And his wife found me online, heard about me, and came, we had a great conversation. And says, anybody checked your testosterone? No, I'm 28, nobody has. We tested it. Now, here's the range is important. When I was in training, the range was 800 to 1200, okay? 3 years ago, it was 350 to 1197. Now they changed it 264 to 916. Some universities have it as low as 175 to 700. Let's stop for a moment. A woman's level when I was in training was roughly between 70 and not considered really high unless to 200. Now a woman's considered 3 to 41. So we have men today are the levels of a woman 30, 40 years ago, and we call that normal. So I said, listen, I walked him through why I want to test this, because the symptoms were low testosterone. No desire for his wife, no motivation to get out of bed, belly fat forming. This young man, we checked his levels. Remember, the range when I was in training was 800 to 1200. His level was 80.
80?
80. Okay? We checked for tumors in the brain. We did all the workup. Everything's fine. He's just low production. So we placed him on bioidentical hormones. And bioidentical is important. Mayo Clinic says bioidentical is that the body recognizes as same. Molecule for molecule, atom for atom, same structure, same function, same limitation. So 6 weeks later, he comes back into our labs. He goes, I'm mad at those doctors who wouldn't even check it. He says, I am back doing things. Now, he's my big doctor for about 3 years, my patient now. His dream was always to join the military. He's not just preparing to get into the Army and wants to get into as an officer. He's now doing triathlons, all right? Here's a guy who literally could not get out of bed, is now, his levels are in the optimal range. He's now has because it's this vicious cycle, you know, catch 22. I'm too tired to work out, but it's not the working out. You don't have no fuel to run. Like, I'm too tired to drive my Ferrari. We have no gas, you can't drive it anyway.
Right.
Now this man is preparing to join the service. He's doing triathlons. He's lost his 30, 40 pounds, and he's back to being energetic, a young 31-year-old.
Well, is it safe? I know you mentioned bioidentical, and it's the same as your own body producing it. But these are pellets. They're going into your skin, and there's, quite honestly, there's a lot of different ways you can deliver.
Yes.
Some not as good. Explain.
Very important here is why it works. When you get a bioidentical, again, the body recognizes the same, so it knows how to use it when it gets it, all right? Now, I don't like calling it a male hormone. A woman, a young woman, based upon her cycle, she makes 10 to 100 times more testosterone than she does estrogen.
All right.
Therefore, it must be important. The studies at the NIH show how it works on the brain for anxiety and depression. So again, there's functions for these hormones, because these hormones tell cells to work, cells tell the organs to work, and the organ is you and I. So back to this idea of how it works, the safety part of it. Let's go over first the why pellets versus injections or oral. In 1935 was the very first time the scientists isolated testosterone itself. The very first paper was 1937. Look at the pharmacokinetics. How could I mimic the gonad? How could I mimic it? That's their question. Well, you want the level to be up and be plateaued, not up and down. Well, that's what it does. It goes up and plateaus. It goes down very gradually. The shots go up and down. That's the problem with the shots. They work well for the few days, but then they're back down again. The creams don't even get levels high. And interesting, oral testosterone in 1947 was isolated, but they knew that it caused increased clotting and cancer. They knew that back in 1947.
Was there any downside that you see at this point? I mean,
here's the downside. It's the misconceptions. I'll go over prostate cancer for men. It causes prostate cancer. Well, the original paper on that was written in 1941 at the University of Chicago. How many men were in the study? One man who already was castrated. It's not applicable today. So Dr. Morgenthau wrote a great book called Testosterone for Life, going through his studies showing no, it's actually more beneficial. And it looks, again, if testosterone caused prostate cancer, then why does every 18 and 20-year-old not have prostate cancer? okay? It's when they go down. A woman, when her levels are high, premenopausal, not when the complication happens, when they drop suddenly. It's the sudden drop of the hormones being optimal that increases the risk.
I want to talk a bit about vitamins here because time goes by quickly, and supplements, because we're very dependent on medicine, prescription medicine. Are there alternatives?
Yes, and again, allopathic medicine, I'm trained in. It's find a cause, find a target, and treat it. It worked very well early on antibiotics. Every other medication just is a band-aid, not the root cause, okay? So what we want to do is we want to go back to the root cause, because our body, given the right hormone balance, the right supplementation. I don't even like the right supplementation. Vitamins are not options. They're literally cofactors in which these processes in our body need to be optimal.
Well, let me ask you straight out. For instance, I've heard you say that vitamin D, for instance, can be more effective against the flu than the flu vaccine. I mean, is that true?
Yeah, the CDC said last year the flu vaccine worked between 3 and 10% of the time. Study out of Japan shows just 1,200 milligrams of 1,200 units of vitamin D per day decreases the flu 800%. And that's why the flu's increased in the wintertime, because UV lights, we're not turning on vitamin D in our skin, so it all goes together. Vitamin D, there's a great papers on vitamin D and Alzheimer's helping delay up to 70% decrease in Alzheimer's progression in those with higher vitamin D levels.
So for someone who's watching today, and I'll bet the vast majority are probably taking some form of prescription drug,
right,
and oftentimes other prescriptions to help with the side effects of the first. Can you, through the supplements, actually get better health than taking prescription?
The answer is depends what the problem is. Like, I'm not going to poo-poo medicine. I'm a MD. I mean, I love that stuff.
No, I understand.
But the thing, Bill, is okay. We'll go over diabetes. Our diabetes was almost negligible 60, 70 years ago. When the food pyramid got in, where's the literature say eating 3 meals a day of grains and 3 snacks a day increases it? The problem was too much sugar, increased too much insulin, therefore put a strain on our system, and that's why we have the diabetes. Diabetes leads to belly fat, high blood pressure, high cholesterol, increased cardiovascular disease. There's a study show men under the level, men who are 540 or higher versus men who are 350 or less. This is done at the VA in San Diego. Showed that men who are under 350 had an 88% higher chance of heart attack in the next 4.5 years. Well, why is that not over the news everywhere? Where is that not everywhere? Menopause. Menopause is a natural occurrence. Yes, it is. But there's sequelae to that being low. Let's go over there. When you stop making eggs, you stop making estrogens. But the problem is, in menopause, you lose 5% of your bone mass every year. 40,000 women a year die of hip fractures. If you take bioidentical estrogen and bioidentical testosterone, you gain 8.3% of bone mass per year.
So you're gaining bone mass instead of losing it.
And therefore 40,000 deaths.
What about the woman who's suffering menopause right now? Does it take the effects of that away?
100%. Again, remember, hormones levels are great when it drops down. And it doesn't mean menopause. It could be in the perimenopausal range, that 10-year window. When the levels go down, you could actually stop those hot flashes, those night sweats. Those aspects can be ameliorated by what? Not by a pill, not by a Band-Aid, but by the actual bioidentical hormone that their body used to make in optimal levels.
Okay, I know you are big about overall health and how to maintain it. And when we come back, we'll talk about how nutrition plays a part in your total body health and how to maintain that. Stick around.